Welcome to another video of Clinical Haematology Unit 5 Haematological Techniques. First video. Haematological Instruments. Haematological instruments are specialized devices used for blood analysis. These include 1. Haematology analyzers, automated machines that count and classify blood cells. 2. Centrifuges used to separate blood components, e.g., plasma, serum, cells. 3. Hemocytometers, glass slides with grids for manual blood cell counting. 4. Coagulometers measure blood clotting parameters. 5. Microhematocrit readers measure packed cell volume, PCV. Flow cytometry. Flow cytometry is a technique used to analyze physical and chemical characteristics of cells or particles in a fluid suspension. Cells pass through a laser beam, and detectors capture data based on fluorescence and light scattering. It is widely used in immunophenotyping, cancer diagnosis, and hematology. Fluorescent and electron microscopy. Fluorescent microscopy uses fluorescent dyes or proteins to visualize specific structures within cells. It is commonly used in immunofluorescence techniques. Electron microscopy, EM, provides high-resolution images by using electron beams instead of light. It is used to study ultrastructure details of blood cells, platelets, and bone marrow samples. Glassware and chemicals in hematology. Glassware, test tubes, pipettes, slides, beakers, and petri dishes used in blood analysis and microscopy. Chemicals, stains, e.g., Wright's stain, Leishman stain, buffers, fixatives, and reagents used for cell counting, differential counts, and coagulation studies. Anticoagulants and their mechanism of action. Anticoagulants prevent blood clotting and are used in laboratory blood sample collection. Some commonly used anticoagulants include 1. Ethylenediamine tetrachic acid, EDTA. Mechanism: binds calcium, Ca superscript 2, which is essential for clotting. Uses: complete blood count, CBC, blood smears, and flow cytometry. Tube color: lavender, purple. 2. Sodium citrate. Mechanism: chelates calcium, preventing coagulation. Uses: coagulation studies, e.g., prothrombin time, PT, activated partial thromboplastin time, APTT. Tube color: light blue. 3. Heparin, lithium or sodium heparin. Mechanism: inhibits thrombin and factor XA, preventing clot formation. Uses: blood gas analysis, osmotic fragility tests, and flow cytometry. Tube color: green. 4. Fluoride oxalate. O mechanism: fluoride inhibits glycolysis, preserving glucose. Oxalate binds calcium to prevent coagulation. Uses: blood glucose testing. Tube color: gray. 5. Acid citrate dextrose, ACD. Mechanism: citrate binds calcium, and dextrose preserves RBC viability. Uses: blood transfusions, tissue typing, and DNA studies. Tube color: yellow. Blood sample collection. Blood is collected using different techniques depending on the purpose. 1. Venipuncture: blood is drawn from veins, e.g., median cubital vein, using a syringe or vacuum tube system. 2. Capillary blood collection: a fingerstick or heel prick is used for small volume samples. 3. Arterial blood collection used for blood gas analysis, drawn from arteries. Steps for venipuncture. 1. Identify the patient and explain the procedure. 2. Select the appropriate vein and clean the site with an antiseptic. 3. Apply a tourniquet and insert the needle into the vein. 4. Collect the required volume and mix anticoagulant tubes by gentle inversion. 5. Label the sample and transport it under proper conditions. Defibrillation technique. Defibrillation is the process of removing fibrin from blood to obtain serum instead of plasma. This is done to prevent clotting when anticoagulants are not used. Methods of defibrillation. 1. Mechanical defibrillation: blood is stirred with a glass rod or metal beads to allow fibrin to form and be removed. 2. Chemical defibrillation. Certain chemicals like thrombin can induce clot formation, leaving serum behind. Uses: defibrinated blood is used for specific laboratory tests where clotting factors interfere with results. MCQs VVI. 1. Which anticoagulant is most commonly used for complete blood count (CBC) tests? A. Sodium citrate. B. Heparin. C. EDTA. D. Fluoride oxalate. Answer: C. 2. What is the function of sodium citrate in blood collection tubes? A. It inhibits glycolysis. B. It prevents clotting by binding calcium. C. It destroys red blood cells. D. It activates platelet aggregation. Answer: B. 3. Which instrument is used for counting blood cells manually? A. Haematology analyzer. B. Hemocytometer. C. Centrifuge. D. Coagulometer. Answer: B. 4. Flow cytometry is primarily used for A. Coagulation studies. B. DNA and cell analysis. C. Urinalysis. D. Microbial culture. Answer: B. 5. Which color tube is used for coagulation studies? A. Lavender. B. Light blue. C. Green. D. Gray. Answer: B. 6. What is the mechanism of action of heparin? A. Binds calcium. B. Inhibits thrombin and factor XA. C. Preserves glucose levels. D. Forms fibrin clots. Answer: B. 7. The best site for venipuncture is A. Radial artery. B. Median cubital vein. C. Carotid artery. D. Femoral vein. Answer: B. 8. What does a centrifuge do in blood sample processing? A. Measures clotting time. B. Separates blood components. C. Analyzes DNA. D. Detects infections. Answer: B. 9. Which of the following is used in glucose estimation tests? A. EDTA. B. Heparin. C. Fluoride oxalate. D. Sodium citrate. Answer: C. 10. Which chemical is commonly used for defibrillation? A. Thrombin. B. EDTA. C. Sodium citrate. D. Heparin. Answer: A. 11. Electron microscopy uses which of the following for imaging? A. Laser light. B. UV rays. C. Electrons. D. X-rays. Answer: C. 12. What is the main function of a coagulometer? A. Counting blood cells. B. Measuring clotting time. C. Separating blood components. D. Staining blood smears. Answer: B. 13. Which of the following is not a function of flow cytometry? A. Immunophenotyping. B. Cell sorting. C. Detecting blood glucose. D. DNA analysis. Answer: C. 14. What is the purpose of defibrillation? A. To separate plasma from blood. B. To prevent clot formation. C. To obtain serum free from fibrin. D. To increase blood cell count. Answer: C. 15. Which anticoagulant tube is used for blood gas analysis? A. Fluoride oxalate. B. Heparin. C. EDTA. D. Sodium citrate. Answer: B. 16. The anticoagulant in yellow top tubes, ACD, is mainly used for A. Glucose preservation. B. Coagulation studies. C. Blood transfusion and DNA testing. D. Complete blood count, CBC. Answer: C. 17. The role of a hematology analyzer is to A. Detect bacterial infections. B. Perform blood cell counting. C. Perform liver function tests. D. Measure blood pressure. Answer, B. 18. Which chemical is used in fluorescence microscopy to stain cells? A. Methylene blue. B. Fluorescein. C. Eosin. D. Hematoxylin. Answer, B. 19. What is the purpose of an arterial blood sample? A. Blood culture. B. Blood gas analysis. C. Blood coagulation test. D. Hormone testing. Answer, B. 20. Which of the following anticoagulants preserves red blood cell viability? A. Sodium citrate. B. Heparin. C. Acid citrate dextrose, ACD. D. EDTA. Answer, C. Study the MCQs. It will help you in your exam. Study topic-wise and practice more. MCQs will boost your confidence. Thank you all.